Dental implants are one of the best ways to replace the missing tooth. What is the other alternative for dental implants? You can replace a missing tooth with the help of a bridge or a removable partial denture. A bridge, however, is a fixed process, but a removable denture is a removable as the name suggests. Now, what is the difference between an implant and a bridge? Just like any bridge, the bridge has two poles, right? Like that, between the two teeth, we are building a bridge. Meaning, if a tooth is missing in the center and the two teeth are there on the adjacent side, what we do is we build a bridge between these two by making this tooth small and adding up a bridge there. So, this tooth is inserted now. In this case, this tooth is inserted. This is the greatest disadvantage. Sometimes you may have to do root canal of this tooth and root canal of this tooth and then build a bridge. The simplest way is, if there is adequate bone, if there is good bone, if the patient is good, medically not compromised too much, that I'll talk later, you can insert a titanium fixture into the bone and then treat the patient. So now, what is an implant? An implant is just a titanium fixture which gets into your jawbone in the place of a missing tooth. Usually in the next 3 to 4 months or 2 to 4 months, the implant will fuse to the bone, and on top of it we will give a crown after 3 or 4 months. 3 or 4 months is minimum. It can be 3 to 4 years later also. If patients come, we can give them a crown on top of it. What is better, implant or a bridge? Definitely implant is better because you will not be damaging the adjacent tooth structures. So it is directly into the bone. So how many type of implants are there? Okay, there are many types now which have come up. Usually the classic way is where you give an implant, wait for 3 months, wait for the implant to heal and fix to the bone, and then on top of it give a cap after 3-4 months. Now the latest thing which has come is cortical bone. Cortical implants are the implants which are put into the cortical bone, where that is the hardest bone which is present in the body. Even though your normal bone is less, we go and anchor it to the cortical bone, which is very strong, and this acts on fixation process. The regular implant acts on osseointegration, meaning it waits for 3 to 4 months to fuse and then we give a tooth. Another type of, as I told you, cortico-basal implants, it works on osteofixation, where we fix it into the jawbone, which will not move. We put more implants. If a normal implant for a full jaw, we have to place 6 implants. For a cortico-basal implant, we put 12 implants. And these implants, the cortico-basal implants, are longer and narrower as compared to the big regular implants. So it depends on the surgeon as to what type of a bone it is, and then decide as to what type of implant has to be given. So what are the complications? Complications of implants, if at all planned very well, are nothing. Absolutely, it is one of the finest, as I always have been telling, and I've been a proponent of implants for over 15 to 18 years right now. And how long does an implant last? Yeah, the implant, if it fuses, it lasts forever. No need of getting it removed, or it doesn't come out generally. However, there are chances that the body may not take up the implant, or the bone may just reject the implant. Maybe that chances are just 2 to 3% or 1 to 2% depending on the company. So there are many implants that are available in the market for both the varieties, the 3 months variety and the 3 days variety. 3 days variety is a cortical implant which we put the crowns in just 3 days. Regular implants, we put the tooth in 3 months. So don't get confused. Go to a very good reputed maxillofacial surgeon or a prosthodontist or a periodontist or an implantologist. Do your homework, do your research, go to them and then explain your situation, and that is the best possible thing your money can buy. Implants are not very economical. At the same time, it has a lot of value for the money that you are spending. Regular single implant may cost anywhere between 20 to 30 to 40,000 rupees also, depending upon the company of the implant or the manufacturer. So good luck, all the best. Whenever a tooth is missing, suggest implants if it is ideal condition. Thank you.